Tonight, I have the honor and the privilege to host one of the best optometrists Nigeria has ever produced. I'm talking about Dr. Oforbuike. Now, Dr. Oforbuike is many things, right? So let me try and read his profile. After that, I'll tell you who he really is. So here, let's just get that. So first of all, he's a consultant optometrist in the specialty area of rehabilitative optometry. Now, that may be a big word. What that means is when it comes to blindness and low vision, we also have a rehabilitation aspect or arm of optometry, right? Where the people that can't really see well, we train them on how to make use of the little vision that they have. So he is a consultant in that specialty. He has over 16 years of practice. Now, this 16 years of practice is from tertiary. He has gone from tertiary healthcare to research. So now he does research and he does academia. He's also a lecturer in the Department of Optometry, Bayero University in Kano. Dr. Ike is a director in Spec Vision Eye Care in Kano. He's a leader in every aspect of optometry in Nigeria. He has received so many awards. If I go into that, trust me, we'll spend the entire 30 minutes reading his profile. But the most important aspect of this introduction is that Dr. Oforbuike is my friend, right? And I won't tell my story of optometry without mentioning his name. Right from the university days, Dr. Oforbuike has been one of the few optometrists that have paved the way for me. So imagine how pleased I was when he said he's going to come online tonight to actually handle this. So I'm going to try and bring him on board so that I'm sending an invite so that he can join us, so that I can stop talking too much and let him get into the... Okay, so Dr. Oforbuike, I've sent you an invite. I want you to accept the invite and join us. If you're having difficulty, please ensure that your app is updated. Okay. All right. So while he's joining us, now I was talking about Dr. Oforbuike, and the good part is his wife is also an optometrist. So when it comes to Kano, people ask me, like I've had patients, come to me and say online that in Kano, any clinic in Kano, this is a couple that I send all my patients to, because one, when I send a patient, here they is. Hi, Doc. Good evening.
Hi, how are you?
Wait, you're still in the office? Are you serious?
Oh, no, I'm fine.
Are you serious, man? Oh, that's awesome. Wow, I love that. You're still in the office. I'm at home. I am happily at home. I'm happily at
That's
home.
fine. I'm still at work.
Wow.
Yeah.
Okay. All
So
right.
can you hear me
Well,
clearly?
I
Can
can
you hear
hear
me
you.
clearly?
I can hear you. Please, guys, if you
Yes.
can hear us, please just indicate. If you can't hear us or see us, please let us know. Okay, I hope you guys can all hear me. So even if you are joining later on to watch the replay, kindly put a hashtag replay. Any question you have, I will see it. I hope you can welcome to Eye Care Online.
Thank you. Thank you very much, Dr. Doris. It's a pleasure to be here.
Yes, and it's a pleasure too. I am so happy that you are here with me, and especially you're going to be handling this topic about myopia and hyperopia. I think with you, I can say the terms, but when you're addressing the audience, you have to mix it and bring in the short-sighted, long-sighted, so people can actually understand what we're talking about. So thank you so much, because this topic is a topic that I have actually dealt with over the months in terms of writing, but I feel that we need to hear from a different doctor, and then I know you're going to do justice to this topic and also give us some illustrations, and then using case experiences. So over to you, Dr. Oforbuike. Thank you for joining us, and let's hear from you.
Thank you very much, Dr. Doris. Welcome our followers and listeners. It's a pleasure to be here this evening, and I understand that we are meant to be very time conscious. So we're going to go straight into the topic. Yes, long-sightedness and short-sightedness. All right, these are layman terms to describe what we call hyperopia and myopia. Yes. we're going to limit our discussion to that. All right. So, firstly, you will understand that the era we are in now is the computer age, isn't it? So, then our forefathers, they were only into farming, fishing, hunting, and all that. Many of them were not educated. All right. So, there was no need really to bring things close to read and all that. So, but a lot has changed. All they needed was their distance vision, ability to judge distances, maybe to shoot the animal or and all that. Maybe they are, that's all they needed pretty much. And you hear some people compare themselves. My grandfather lived up to 90 and didn't wear glasses. So why will I wear glasses? So that analogy is so wrong because we're in the modern age, all right, and a lot has changed such that the tasks we do now have moved from distance to near. A lot of computer work, a lot of writing, desk work, and all that. So you see that a lot is different, and the number of people wearing glasses, have increased. So and that now predisposes anyone to tasks like you need to focus. Is that also what we call accommodation? You need to aim at what you're reading. That's what we call convergence. And also the eyes have to team up together. All right, a team. So that's what we call binocular vision. So these three things must have to happen accurately, and it must also have to happen without stress on the eye or the eye being weak or fatigued or tired. All right, but that is not so. All right, for someone who has long-sightedness and short-sightedness, because once you have these two things, it will render you prone to having some symptoms and signs because the normal person is even having a pressure to cope with focusing. You that has myopia and short-sightedness, you are in a different world altogether. So the first thing I'm going to say this night is that the issue of wearing glasses, which many people are running about, there is one option, number one option on a lighter note, is that if you do not want to wear glasses any longer, you may have to teleport yourself to the ancestral age, the stone age of our ancestors, where you only have to maybe go back to the village where the village farm is waiting, all right, and that will add more food to the basket of the nation. On a lighter note, anyway, all right. But on a more serious note, and quickly, do I go ahead?
No, go ahead.
Can I go ahead?
Yes.
All right. So on a more serious note, long-sightedness or short-sightedness, I'll first and foremost take long-sightedness, all right? Someone who has long-sightedness will have symptoms like, number one, because they always focus at close distance, they will have issues with, being able to cope with what they are reading. They are always tired after reading. They have a headache, all right? Some of them have pulling sensation, eye strain. They feel as if the head is full. Many of them will have blurring of vision. When they read for some time, they will tend to lose attention. They will tend to lose concentration. They are just fatigued, all right, because of close work or focusing. I just call it strenuous vision, or what we call as myopia, all right. So many of them feel that strain whenever they are reading. So that brings us to, apart from having these symptoms, many people will also feel tired. You see, if it's a child, you find out that many of them will feel they will give up reading. You see, they are more interested in outdoors. They play outdoors. They prefer. They take pleasure in things that will take them outdoors. If you, this child, you're always very playful. Parents think that they are playing tantrums. No, the child is actually exhibiting some behaviors to avoid those things that make him uncomfortable. All right. So with these symptoms of long-sightedness, which makes the eye be under so much strain, and the muscles that control focusing and aiming to be under so much, pressure, the option a long-sighted person has, number one option, is that a long-sighted person can undergo or call controlled eye exercise or vision training or vision therapy. All right. So you may ask me, what kind of training is that? Because I've seen there are different aspects of exercise. Dr. Doris, I'm still to come to Uyo to benefit from your eye, right? Yeah, that's still a date, okay? So while we're talking about that, that is one aspect of exercise that could help, generally to regulate, the flow of blood to the eye system and all that. So that's one area. But on the other area, I want to liken it to the car. Your car has two tires in front and at the back. These two tires must work, together as a team. All right. You find out that if your car has good balancing and alignment, all right. If you're driving on the highway, you can even hands off the steering, and the car will still be moving in a very straight line because of teamwork. All right. So that is where aligned and balanced will are teamwork. The eyes work in the same way. For us to be able to see, both eyes should be able to work in a controlled manner together to keep the image where they should be at the back part of the eye, making the light go straight and form a focus where it should be. All right. So, but when there's no teamwork, one is overworking or the other is not working, or they are overdoing it or not doing it well, there will be need to exercise or train them to be able to work as a team. All right. So they are not doing enough or they are overdoing it. So vision training or exercise we are talking about here, which a long-sighted person will benefit from, will help to improve the function of focusing, aiming, and teaming of the eye, so that that individual or that child can perform tasks more effectively and keep the image in the right place, the right way, and at the right time. So number one option, controlled exercise, eye exercise, or what we call vision training or vision therapy. Is there any question on that, or do I go ahead?
Yeah, I actually want to ask something. Can you hear me very well?
Yeah.
Can you hear me?
Yes, I can hear you clearly.
Okay, so now when you talk about this eye exercise, are there certain, like, because you kept saying, using the word controlled eye exercise. So what do you mean actually? Like, are there exercises that somebody can actually do at home, or must it be done in the clinic or something?
All right. Now, thank you for that question, Dr. Doris. Long-sighted people, people are long-sighted in varying degrees or amounts, by varying degrees or amounts, right? So the people, the long-sighted people or individuals that would benefit from this eye exercise are usually number one, children. The reason why I say children is that they have the most active visual system that is so dynamic and eager to overwork, just like they are. All right. So number one, children. When I say control, number two, when your long-sightedness is of high amounts, that is, you have what we call high hyperopia, you benefit from it. I'm coming to the control there. Then when your long-sightedness in the two eyes are unequal, when the amount in one eye is different from the amount in the other eye, you find out that there's an imbalance, all right? So what we call anisometropy. So anybody that has long-sightedness that is not of equal amount in the two eyes will benefit from vision training or this eye exercise. Then whoever that does so much focusing, so that the muscles are so strained, and then the stress will make, for example, children, many of them, the stress will make the eyes to actually turn to form a squint, right? So if this focusing system is so active in that long-sighted person that they notice that their eyes turn in, sometimes the person will benefit from visual training. Now, what do we mean by control? It means that the optometrist will check will make you undergo examination. All right, one, to check how severe the symptoms are, when did this start, how long have you had the hyperopia, how much near work do you do, or the demand do you have on your visual system, and then how willing are you as an individual to comply with the instructions, because some of the instructions will have to be done in the clinic, and then you must some weeks, some in months, depending on the level of your competence. So use most of them in the clinic to teach you, all right, on how to do it, and then we'll give you the ones you'll be doing at home. Like you just go home and do it. Must be an appointment, controlled, and with follow-up, much follow. Thank you.
Hello.
Yeah. Do I go ahead?
Yes, I can
Yes, I
hear you, but
can hear you. Can you hear
it
me?
seems to be freezing. I don't know whether it's on your side or my side.
All right. Did you get the last thing I
Yes,
said?
I got what you said. I got ahead. Now I'm seeing you better, but it still seems to be
Okay.
freezing. I don't know whether it's freezing on other people's screen or just on my screen anyway. I don't know. Is
All
it
right. All
freezing on
right.
your screen?
No.
It's not. Okay, because that means it's on my own side. Okay, don't worry. Go ahead. I can hear you very well, actually. I can
All
hear
right. If you can
you very well.
hear me clearly,
I can
I
hear
have
you.
already
Yes,
explained
yes.
yes, that it
So,
takes weeks or months with
yes,
regular clinic visits. Did you get
yes,
that?
yes. Okay, so
With regular
now,
clinic visits.
okay, so now we have our first option for people that don't want to wear glasses. For those that are long-sighted, is controlled eye training, right? Vision training, that's the word anyway.
Yes.
Okay,
Exercise.
all right, that's
Exercise.
awesome.
Yes.
Okay, eye exercise, okay. It's all right. Please continue.
Okay. Then let's talk about the people that have short-sightedness.
Okay.
All right, short-sightedness is in a world of its own because it has a strong hereditary factor or genetic factor. People that are short-sighted, almost always there's a strong family history.
Mhm.
All right, so I'm going to start with these people by saying that the short-sightedness in children or in an individual must have been there from birth. All right, so because we have this hereditary component to it, I will start my option from genetic counseling. Just like when we want to settle down your partner and all that, there are so many investigations you have to do to check compatibility in order to reduce the odds of having offspring or children who will be less disadvantaged in one way or whether blood group, sickle cell, and all that, resource factor. Myopia is one of them. All right. So I'm not saying that people shouldn't fall in love or feel free to fall in love, but it's something you have to consider if you're single or you're already short-sighted when you're choosing a partner. All right, to reduce the odds if you do not want your children to use glasses, because we are talking about are there options of dropping or not using the glasses. Then we have to start from the roots. You have to actually choose wisely. Is that okay? That is number one, genetic counseling. Then number two, then we are going to okay. I was talking about genetic counseling for myopia or short-sightedness. Now I want to go into ergonomic modification. Ergonomic modification simply means having to do with the environment or the nature of what the short-sighted person is involved in. You first and foremost, strong evidence from studies, research that has been carried out has shown that people who actually sleep late and wake up late, all right, and because the reason for sleeping late is because they spend more time on screen. So when I say screen, I mean digital devices like computer, television, laptop, and all that, pumped up, and as many as they are, all right, and being involved in some activities that require near focusing, all right, and make them sleep late and wake up late has been a strong correlation to the development of short-sightedness and also the progression of short-sightedness.
Wow.
When I say development, I mean short-sightedness happening at all or occurring, or when it's there, growing from one stage to the other, getting more in amount. All right. So this study now means that children, especially our young people who have short-sightedness, are being encouraged as much as possible to drop or leave anything that involves focusing at night and go to bed early and wake up early. All right, that is number one. Number two is that they are also encouraged, if you wear glasses and you know you are short-sighted, to also involve in less focusing activities such as reading. Many of us bring work back home. Many of us bring assignments, things that we have to do late into the night. We are still on them reading at night. I understand it's unavoidable as a student, as a young person, trying to make ends meet. All right, but it has been predicated as a reason for the development and increase in myopia. All right. Now, also, while doing that, they are doing it with artificial lighting. What makes it worse is that when I say artificial lighting, the illumination of the room, of the bulbs in the house and all that, these are artificial lighting. So it becomes a vicious circle of using artificial lighting late at night to be involved in near reading or focusing, or on spending time on digital devices, television and screens. All right. So this compounds a problem to cause and compound short-sightedness. So number one option, if you have the hope of benefiting from dropping glasses someday, all right, or having it become less, significant in amount, that means you have to revisit this way of life of sleeping late, waking up late, involving in near reading at night, focusing on digital devices, and other screens. That is another factor. Strong evidence, studies have shown. Then another study shows that spending more time outdoors is a very factor that can help in the reduction of myopia, even the incidence and progression of myopia. What do I mean by outdoors? Because there's a lot of campaign going on, awareness creation in optometry and eye care world about how we can control the progression of myopia. And it has been found out that spending time outdoors, all right, is a very good way of controlling myopia. And when we say outdoors, it's not necessarily about looking at things that are far, but it is about the intensity of light, higher intensities of light, unlike the artificial light and bulbs we have in our rooms. All right. So the higher intensities of light, which when we measure it is from sun and all that, 10 to almost 2,000 loss in amount, it helps to produce inhibitory factors that discourage the growth of the eye. Because myopia or short-sightedness, one of the causes is that there is growth of the eye, so that the eyeballs are longer than they should be, making the focus to be in front. So that growth of the eye occurs even throughout life in some myopic patients or people that have short-sightedness. But when you're exposed to outdoors, the higher light that is available outdoors will produce inhibitory factors that discourage eye growth. That is why spending time outdoors, unlike what we used to have, children of these days, they are so unlucky. When we were growing up, we used to play with our friends in the neighborhood, in the compound, we run around on the sand and all that. Now, your children hardly know who their neighbors are, or in the estates, all right? They stay indoors. There's no reason to make them go outside the door. It has helped in the development and progression of myopia, which we are now advocating. That one way, if you hope that one day you're going to drop that glasses, or it will not be an option for you or for your child, start now to encourage them. And from the study, it was shown that at least exposing them to at least 40 to 80 minutes of per day is enough to significantly reduce the incidence of myopia. When I say increase in time outdoors of 40 to 80 minutes per day, if we take the average of about 40 to 80 minutes, that's about 60 minutes every day. That is about 1 hour every day to go out, not for doing anything else, but just to be exposed to outdoors will help in significantly reducing the incidence of myopia, and maybe one day you having the hope of dropping that glass.
Can I come?
All right?
Yeah. Can I come in here? I don't know what's happening. I don't know. Right now,
it's okay. It's typical of our environment. All right, fluctuating nature.
Come to think about it, this Nigeria is get on my neck.
It's all
okay. So
right. I can hear you clearly. Can you hear me?
Yes, I can hear you. So I was talking about the issue of this short-sightedness, right? Because I've seen many patients right now. Like I remember when we were growing up, right? And maybe you see just one child wearing glasses. Can you hear me very well?
Yes, I can.
Okay, so You see just one child wearing glasses. But now, if you go into a classroom, you may end up seeing like 10 or 15 children wearing glasses because of the fact that you have this, like you mentioned, parents now keep their children indoors. Like parents literally go out there, buy tablets, buy phones for their kids. And which, of course, you can't blame them because the world has gone digital. So the kids have to learn how to use all those things. But now the shock happens. Now it now comes as a shock to these parents when their children develop short-sightedness or other eye problems that has to do with this. And you tell the parents that you need to expose the child to outdoors, let the child go out. And then they have the fear of insecurity, right? So now this is a situation that we have. And the truth is this: no matter how we preach about it, many people don't trust the next door neighbor to take care of their children. Like when we are growing up now, our mothers can leave us with neighbors and go to markets, go to other places and come back and you're fine. We can't trust the children. So as an optometrist, and of course you're a researcher, what do you think? Because you can't tell parents not to give children tablets and phones. And then of course, maybe they may not be able to expose the child to outdoors up to 1 hour per day. What other option do you think that they have? What can they do? If this child has to be on tablets, on phones, what can they do to protect the eyes of this child?
All right. Because today is dedicated to options to glasses, I'm trying to hold myself from talking about options in glasses. Is that okay? Because that would have answered your question, what they could do if they can't go outdoors and they are stuck to the digital device, maybe because of online learning.
Yes, sorry to cut in, right? Now, option may not necessarily be that this child is short-sighted, but if wearing glasses for a short time, a type of glasses can prevent this child from depending, because there's a difference between the child is short-sighted, the child can't see, the child now depends on the glass, which is the fear of many parents, having their child depend on glass. If there is a solution, like a short time wear, something they can use for a short time, I don't know if you understand, that will prevent them from depending on, say for example, my husband is a myope, and a high myope for that matter, right? So because he's a high myope, I know that I have 3 kids, and I know that somehow it's in the genes. My father-in-law is also a high myope. So I expose my children outdoors literally every day. And then every time during the long vacation, I do cyclo. Okay, sorry, I do cyclo refraction on them to rule out any problem. I don't know if you understand. So now I am observant, I am watching. So I would like to know if there is something I can do, because they are also on the phone, like they literally have their own phone and they drag my own phone sometimes. Is there, what can they do? What can I do to reduce them, from becoming myopic, know that it's already in their genes? I don't know if that, I don't know if that kind of, if I explain myself well.
Okay, you have. Within the confines of what they are exposed to, all right, you can't take this away from them. There is something you can do, apart from what you're already doing, being vigilant, monitoring because you have the knowledge, all right? Generally, we can play around devices. If this thing has come to stay, all right? Are you listening? If this thing has come to stay such that they depend on devices, they learn from it, they study with it, and they are, now you can play with device in the sense that the television, which is not as close up as the tablet or the phone in your hand, all right, you can actually project what you have in your phone to the television, to your bigger screen. All right, you can use a HDMI cord. All right, you can buy, there's an app that can actually make what you have on your phone to be showing on the screen. That can help increase their walking distance, all right, their viewing distance, so that it will at least not be as close as using the ones on their hand or on their lap. So you can play around interconnectivity of VDUs and HDMIs to project whatever they are using on their phone or on your phone, on the laptop, to the bigger screen for them. Explore that, all right? That way, they have it bigger, they have it over there, and accommodation is relaxed. That is one thing you can do at home if you cannot leave the house, all right? Good. Now, also going to talking about options because of time, all right? We now go into contact lenses. Contact lenses is the most popular alternative to wearing glasses. All right, it's so popular, even though the acceptability in our own immediate environment is not as it is in the developed countries, but it's so popular that anyone who wears glasses can actually have it converted to contact lenses. Anyone, regardless of what your power is or your refractive error is, long-sighted, short-sighted, or the other types. All right, and contact lenses are safe to use. They do not injure your eye as long as you comply with the wearing and caring instructions. As long as you go to an eye clinic, see an optometrist, undergo tests, diagnostic tests to get you the appropriate contact lens power that has the same curvature as your eye, and it is fitted. You are taught how to fit it, the do's and don'ts of wearing it, of removing it, of caring for it. Contact lenses, people have been wearing for years and they cannot even think of going back to glasses any longer. They only have glasses as backup, but they cannot do without contact lenses, because the advantages of contact lenses are they outweigh wearing of glasses. For instance, number one, the vision through contact lens is more comfortable and more natural. All right, you appear to be wearing no vision correction whatsoever. You understand? Just like as I am now, I may be wearing contact lenses, but you wouldn't know. You don't even need to have it in a colored form. All right, and it is compatible with some occupations and sports. You can play sport with it, you can look into the microscope with it, you can do so many things with it. All right, it enhances your looks, you can change eye color, it's fashion compliant and all that. You just need to comply. All right, and contact lenses must be got in an eye clinic after eye examination. We do not encourage buying cosmetic shops, buying by roadside. Many people, we have patients that we are managing who have come down with complications of contact lenses because they bought it from shop and they developed contact lens related complications. Please do not do that. But it is one of the easiest, simplest, most convenient and comfortable modes of correcting your long-sightedness or your short-sightedness. It's even as easy as wearing your earring or buttoning your shirt in the morning and you go your way. All right, so contact lens is a very easy option, and I hope and pray that people can explore that option and drop their glasses. All right, so that is another option. If until a question comes up, I'll move ahead. All right, the other option, can I go ahead, please?
Yes, you can.
That's okay. The other option is what we call autokeratology. Auto-K. All right. Autokeratology simply means that we are making. Okay, let me give you an instance. All right. When you have someone who has a bow and arrow, you know the what do you call it now? The weapon called bow and arrow. All right, that they use to shoot. All right, good. For you to make more impact or kill someone or pierce something, you have to bend the bow very well. All right, you have to make it very well bent. So the more bent it is, the more power it has. Is that not so?
Okay.
Good. So a flat bow is almost like a useless bow until you bend it. Is that not? So people that have short-sightedness have the curvature of their eye to be so bent, so the power of their eye is so much, that is why they have short-sightedness. All right, so the other option we have is to find a way to make this curvature of the eye to be flatter than it is. All right, so anything that will make the eye to be flatter in its curvature will go. will make short-sightedness to be reduced. So auto K is just like when we used to do what we used to do when we were students. We have a cloth we want to wear the next day. We don't have any iron around. We just fold it, put it under our pillow, and sleep on it, hoping that in the morning it will flatten out and be straight. Do you understand? So auto K is simply giving you, when you come to the clinic, the eye doctor will wear you a type of contact lens that you're going to sleep in. When you're sleeping in it with your lids closed, the lens will flatten your cornea. When you wake up, you don't need the contact lens again. The cornea is already flat because of the effect of the lens. And throughout the day, you can go without wearing glasses and you have clear vision. It is not invasive. It is not a procedure. Just that we have used something to press on the cornea for a while. But the only thing is that you have to be doing it, for weeks before the effect can be and it's not permanent. All right? So you have to be doing it and over and over. But you walk throughout the day with wearing no glasses at all. Auto K. Auto means that the cornea, nothing is on it during the day. It's just made flat. All right? So that way, people can actually, have their cornea reshaped, the cornea flattened, and they have good vision. All right? So you also know that this process is effective, and you don't need to also have, because the next option I'm going to give us now, we'll have to talk about surgeries, all right, which are more invasive, more radical methods. The last resort. All right, so we're going to the last resort, all right, which is surgeries. But we have to talk about it, all right, because people go to change the shape of their nose, change the shape of their backside, change the shape of the front side. So why not give them an option also of what they can change on the eye? All right. So all you just need to do is to go under the laser knife. It's actually laser, no physical knife. All right. It's very effective. All right. All we need to do. The first one is called LASIK. Think of the onion. All right. The onion. You remove the first layer, scrape out some other ones under it, and cover back the front, the outermost one. All right. That will help to flatten it. So short-sightedness will not be there for a while. But the thing is that it's invasive, it's delicate, all right, and that will actually make you in old age, all right. You may have to be going for more surgeries and all. That is one of the disadvantages, but it's very effective by laser. Another type of laser will not cover back the front part. It will actually remove that front part. Here, healing will be needed. There is more pain, all right, here, all right. So they just discard that layer. You have to undergo recovery and all that. You have to use medication, but once it heals, it is known to also help to control myopia. But why go through those invasive procedures, those radical procedures that you need to, over the years, be revisiting, still going under the knife to maintain it? All right. Why go under that when you have options that you don't need to, alter any part of your eye? All right. There's also another one that is not as invasive as these first two that I mentioned: LASIK and PRK, photorefractive keratectomy. This one is implants. They can put implants, right? The same way that we aim at flattening the cornea. Our aim is to flatten the cornea. All right. All they just need to do is to put an material back of the cornea, so that when that material expands, the cornea will be flattened. It stays there. It is not as invasive as the other ones, all right? These options will make one drop glasses, but the only thing that we have about them is that they tamper with structures of the eye. But in a good facility, in a good environment, with good expertise, with up-to-date technology, people go for it and they have dropped glasses. But remember, we started with the very easy ones, with the ones that you have your doctors close by. Dr. Doris that can, close by, you can always do, and you don't have anything and no complications at all. We started with those ones, all right? Forgive me for starting on a lighter note that you can you can quit your job, withdraw your kids from school, back your phones and laptop, stop reading, move back to the. That is the easiest method, right? You don't have to worry about glasses. But remember, you can actually start sleeping early. You can actually start waking up early. You can actually stop bringing work home. Stop involving yourself in near focusing tasks, all right, that make you sleep late. Use artificial light, all right. Start spending more time outdoors, all right. That will help to relax your accommodation and give you more light. That will discourage growth of the eye. Consider the option of using a contact lens. It is one of the easiest and simplest. Consider going for controlled eye exercise, vision training, all right, which they can take you through, all right, and with that, your eyes will gain enough reserve to be able to focus easily on their own, adapt, work better as a team, handle light more straight without the use of glasses. These methods have worked very well, very efficiently, and long-sightedness and short-sightedness they don't need to be a burden. You don't need to avoid your doctor. You don't need to have high blood pressure, when they tell you that you need glasses, because those options will be available to you. Thank you, Dr. Doris. I'll expect questions if there are any.
Oh, thank you so much. Like, you really made this easy. In spite of the technical issues and all that, the way you just continued, I don't know. So, because after this, usually I put the videos together and put them up on YouTube. Okay, so sometimes I get comments, questions that people watch. So now that we have 3 different videos, I have to join that and then put it and turn it into one video. So first of all, one of the challenges we have is that, but I'm talking from experience right now, as a doctor, is that we have patients who they don't want to wear glasses, right? And they don't want to, will I say, do what they need to do in order to reduce their chances of wearing glasses. You find somebody that, like the other day, I heard of a lady that she does this remote jobs, and because of the kind of job she does, she works for a different country whose time zone is our night, and all that. So now she spends the night communicating with them, spends the day working on their job. So you find out that day she came to the clinic, her eyes were kind of swollen. And in trying to understand what's going on, she now, as in the case history, she now told me that she doesn't sleep. She gets if she gets 2 hours of sleep in a day, she's left work. So I now told her, this job is literally killing you. It's making you blind. Because when I now did the test and all that, of course, she's also presbyopic, so that she needs glasses. But hers is early, she's 38 years. She told me, no, I don't want to wear glasses. But you're not fitting your eyes. You're not helping your eyes. You're overworking your eyes. You are on your device for close to 16 hours, and you don't want to protect it, and you want the eyes to still serve you. That is part of our problem. And you find out that no matter how you cancel this patient, like you said, they will tell you how their great-grandfather, lived to be 90 and they never wore glasses. And I will tell them, you cannot compare your great-grandfather's time and your time. Great-grandfather did not use Android. He didn't even use button phone. He used to go to the market square or village square and meet his friends. He used to go to the farm. He used to go outside. He was communicating with nature. Many of us don't. All we know how to do is device. We live in the virtual world. Literally, we live in the virtual world. So what you just said right now, these options that you said, that just did tonight, I'm going to break it down into articles, and I'm going to do the best I can to communicate with the audience in Eye Care Online. And then spec vision. Let's come back to spec vision, right? Spec vision is in Kano, and I know that spec vision is actually my best. I know I have friends in Kano, other optometrists in Kano, they know when it comes to spec vision, I'm very passionate. So now I know that these glasses, blue cut glasses, actually help reduce the strain a bit. So I would like to know, does spec vision give that out? Because I feel that if people can protect their eyes from glare of the device. You can't tell them to drop the phone, but they can do something to protect their eyes. So spec vision, how do they come in when it comes to dispensing these blue cut glass glasses and other means of prevention? How do they come in, please? Can you tell me?
All right, thank you, Dr. Doris. Spec Vision Eye Care is known to put more care into eye care. All right, we go the extra mile. All right, we are known for prompt, efficient, quality eye care service. All right, and we use the very highly motivated staff. All right, with modern equipment in a client-friendly environment, and we listen to our patients. We get feedback. These are the things that have helped us to render quality service over time. And just in line with the question, all right, we're well positioned in view of the nature of Canada. When you talk about climate, the weather, and all, it's in the hot region. The sun and all that are the extremes. So with such high temperatures, hot, dry, weather conditions, and the UV rays on this part of the country, comes out as early as 8 a.m. to 9 and stays as late as 5 to 6 p.m. That's an unusual climate. So the population here, they need eye protection. And that from education, we do our best in public eye health education to let them know the need for them to protect their eyes. And as many that have found their ways to our doorsteps, we have exposed them to various lens options. All right, those that will help them, they are UV protective. Those that will help them reflect. Those that will help them with sun. Those that will help them in their occupation, the blue cuts, many of them, all these protective coatings of lenses, all right, we stock them and we encourage them through public eye health education to go for them, and as much as possible, make it affordable to them, for them to know that you don't have to actually, break or boggle a bank to be able to afford protective eye wear. So we are well positioned. We are, at the forefront of educating patients, all right, and we're doing our best to ensure that they get the best, all right, from us. So we're doing, all that, and we continue to do it to our teeming population of patients in Kano.
I know, I don't have doubts in what you and Vivian can do. I have no doubts at all, because one, I have worked with Vivian in other aspects of life, so I know how passionate she can be when it comes to eye care and, of course, her patients. And then, of course, you know, right from school, I know how meticulous you are when it comes to education. People don't know that I pass optometry. It's mostly you, because I know how you educated me. I know how you helped me, you tutored me. So when it comes to patient education, I give it to you. Like when I talk about when I talk to patients, somehow I remember how you used to teach me that time. You must understand this and all that. So I am not surprised that you became a lecturer as well as a clinician. I am not surprised, because
on the lighter note, in our class graduation, what do you call it, yearbook, they used to give out class awards, all right? The most this, that. You will not believe that my class award was most likely to be a lecturer.
Are you serious?
Yeah. Because how I used to, take them through, my own classmates, through study classes and all. So probably it's a gift. I think it's a calling and a passion. All right. So I think I just need glory to God.
Oforbuike, you are doing so well. You are doing so well, and your students don't know how lucky they are to have you. I mean, look at me. I am your student. I'm your student, and I can say when it comes to patient education, I'm not doing bad at all, and I will say thank you. you. What's done tonight has really helped me. I am sorry about the technical issues. I'm going to put them all together, and I'm also going to send you the link so that you can see how we put it all together. My team will work on it to make sure that it's all coming together. So thank you so much. And please be rest assured that I'm going to call you again, maybe on a shorter, on a different topic and all that, because we are evolving. There are so many changes we are going to bring into eye care online, and I want it to be a part of it. You know the plans you already have, so you know you are part of this. So I'm going to be doing some promotions and some posts about, because I want my country people to really, really come to you. I will trust it with my own eyes, so that is why I want them to come. So let me release you. I know we said 30 minutes and we spent over an hour. Thanks to network and phones. So let me release you to go home. Thank you so much for staying. I really appreciate this.
Dr. Doris, I must take time to thank you profusely. You've been wonderful, in educating the public in the eye care online. You've been a very household name. Our presence, in eye care world, you are almost a role model. We are even envying you. But we are trying to keep up. Is that okay? When it comes to publicity and getting the patient, I've seen some of your referrals. I thank you also for your referrals from as far as Uyo to Kano. Many of them have come through you. Many people have got more enlightened, more educated, more aware of what is going on, that they need to ask questions. I've seen someone that actually admitted that it was through you that they knew that they have to ask questions. Before, patients lived in the world where the doctors are like gods, they meet God. You don't ask questions. A patient just goes with a drug, doesn't know the reason for the drug, the name, or why it's being given. All right. So through what you're doing, the team, people are getting more involved, more knowledgeable, more aware, more informed. So it's all going towards what the World Health Organization is advocating. All right, education, taking it down there to the grassroots. Taking it down there to the people, not sit back in the comfort of your clinic and wait for them to come. Keep the message out there. Doris, as yet, continue doing what you're doing. It's a good job. I must always identify with you. We have come a long way. Whatever you're doing, you can be sure that I'm a part of the team, and whenever you call on me, I'll always be there to answer you. Kudos on the good job you're doing.
Thank you so much. All right, thank you so much. So let me release it to go home now. So Vivian will not be angry with me. Okay. All right. Good night, sir. Yes,
thank you, viewers. I appreciate them for viewing and tuning in. Thank you so much. Have a good evening.
All right. Good evening.
Yeah. Bye.
Okay. All right, so thank you to everyone that stayed, and I am so sorry for the whole network issue. That's Dr. Oforbuike, and I know that the whole 3 videos and all that, but I'm going to put them all together. I'm going to post them into the Facebook page. So after this, I'm going to remove all of them so that I can put them together as like one video, and then put the link. So it will be on YouTube after this, so that we can follow up. We talked about different options. So if you're someone that you don't want to wear glasses, we talked about different options, what you can do to help you. And then we also talked about what you can do to help your children not to wear glasses. But the bottom line is this: we need to look at glasses a different way. Okay, it's not bad. It's something that we should look at as like call it stigma or something. No, glasses can be fun. It can be fun, and what we're trying to do is to prevent you from depending on them. But if it comes to using glasses and doing surgery, please go for glasses. Okay, go for glasses. Leave the surgery, because glasses is non-invasive. It's just there. You wear it, you remove it. Surgery can be invasive, and anything can go wrong in surgery. So when it comes to long-sightedness, short-sightedness, yes, you have options. But you have to also listen to your optometrist, who will educate you based on information on the ground, and then availability and accessibility. What are your best options? So do you have options? Yes. Must it be glasses? No, it mustn't be glasses. So it's now for you to identify what is your best option. Okay, so tonight hasn't been go as planned, but we are grateful that you stayed with us to the end. If you're watching this on YouTube, don't forget to subscribe. If you're watching this on Instagram, don't forget to follow and also share and tag your friends to the video. Thank you so much. And if you are in Kano, you have an eye issue, don't forget Spec Vision is our partner clinic. I'll be dropping the address and phone numbers so that you can reach out to them. They take care of the eyes comprehensively. And like I said earlier in the video, I trust them with my own eyes. So you can imagine how much I believe in this team. It's a team of husband and wife who are both optometrists. So you know the two sabi book, two of them, they can jack very well. You think I'm smart? Go and meet them. You understand what I'm talking about. Thank you for being a part of IK Online tonight, and I hope to see you very soon as I will drop in some videos that I'm sure you will find valuable. You have a good night rest.